The removal of impacted wisdom teeth is quite different from the extraction of erupted teeth,
which may result in any of the following conditions, all of which are considered normal.
The operated area may develop significant swelling.
It is not unusual to have difficulty opening your mouth completely after surgery for a period of 7 to 10 days.
You may develop a slight earache or a sore throat.
Your other teeth may ache. This is referred to as sympathetic pain, and it's a temporary condition.
If the corners of the mouth are stretched, they may dry out and crack. Your lips should be kept moist with a cream or ointment.
There will be a hole at the site where the tooth was removed.
This area should be rinsed after meals and at bedtime, beginning on the second postoperative day with warm salt water.
The area will gradually fill in over a period of several months with new bone and soft tissue.
There may be a slight elevation of temperature for 24 to 48 hours. If temperature remains elevated, please contact us.
If you are put to sleep with an injection in your arm and a bruise appears around the injection site, do not be concerned.
This is not abnormal and will disappear.
Small but tender oral ulcers may appear after your surgery. This will resolve over a course of a few days.
Extraction sites usually heal quickly and without complications if simple precautions are taken.
Reduce your activities for 24 hours after surgery.
This helps reduce bleeding and permits the formation of a clot at the site of surgery, which is necessary for uncomplicated healing.
Swelling is to be expected.
Place an ice pack on the affected area immediately upon return home. 15 minutes on, 5 minutes off. Do this for the remainder of the day.
Swelling usually reaches its maximum within the first 48 hours and then slowly decreases.
The application of warm, moist compresses after 48 hours will promote rapid reduction of swelling.
Keep in mind the use of moist heat prior to the 3rd day may result in bleeding and excessive swelling.
Maintain the gauze pads over the extraction sites for 2 to 3 hours with firm biting pressure.
When the gauze pads are removed, the extraction sites will continue to ooze slightly for several days,
coloring the saliva pink to a light red depending on the number and the difficulty of extractions.
The oozing of blood is normal and can be expected with all 3rd molar extractions.
However, if heavy bright red bleeding resumes after removal of the gauze, the following procedure should be used.
Take a clean gauze and gently wipe the blood from the mouth.
Fold another clean gauze into a compact pad and moisten it with tap water.
Place the pad directly over the bleeding area behind the last visible tooth and bite firmly.
The gauze pad must apply pressure to the extraction site.
Merely placing the gauze between the teeth and biting on the pad will not stop the bleeding.
Maintain the pressure for about 30 minutes. Repeat if necessary.
If bleeding continues, take a moistened tea bag and substitute it for the gauze pad.
Tea contains tannic acid, which is a strong astringent, and frequently will stop active bleeding when gauze alone is ineffective.
Do not spit. Spitting disrupts the clotting of the blood at the extraction site and prolongs bleeding.
If necessary, rinse your mouth lightly with cold water to remove any saliva or blood.
Do not use straws for the first week.
If bleeding persists or other unusual conditions appear, call our office promptly.
To help the healing process, try not to miss a meal after surgery.
A cool to warm liquid diet is ideal the day of surgery.
Be sure to drink plenty of fluids.
Water, milk, coffee, tea, and juice.
On the 2nd and 3rd postoperative day, your diet should consist of soft foods which will not irritate the surgical sites or cause bleeding.
On the 3rd day, solid food can be added to the menu.
Here are some foods we recommend.
Yogurt,
eggs,
soups,
custards,
mashed potatoes,
cooked cereal,
and Jell-O.
1 ounce of carbonated water for every hour for 4 to 5 hours will usually ease nausea.
When hunger returns, mild tea or clear soup are better tolerated than heavy or coarse foods.
Have prescriptions filled promptly and take as directed by your doctor.
Non-narcotic medications such as Motrin, Advil, ibuprofen, or Tylenol should be taken as soon as possible and repeated as prescribed for the first several days.
Narcotic pain medications can be taken as directed by the doctor in addition if pain relief is not adequate.
However, when narcotic pain medications are taken, you should not operate automobiles or other power equipment.
Antibiotics, when prescribed, should be taken as directed until they're completely gone.
If a rash or swelling develops, discontinue the antibiotic immediately and call the office to inform your doctor.
The extraction sites should not be disturbed, allowing adequate time for clotting to occur.
The mouth should not be rinsed on the day of the surgery.
The day following surgery and for 1 week after, the mouth should be rinsed gently with warm salt water after each meal and at bedtime.
The teeth should be brushed as usual, but the surgery site should be avoided.
It's helpful to soften the bristles of the brush prior to use by placing the brush in a cup of hot tap water for several minutes.
It's important to maintain oral hygiene so that the wound will heal properly and not become infected.
Smokers are advised not to smoke for at least 72 hours after surgery.
Drawing on a cigarette may disturb the blood clot and thus interfere with the healing process.